Big changes took effect in the pharmacy world in Ontario January 1st. Those in the profession, like our next guest, Jamie Ikola, can now prescribe medication for 13 different minor ailments. Jamie, is this something that pharmacists have been lobbying for over the last few years?
Yes, it is. It's been in the works for a while. I think the Ontario Pharmacists Association has been closely working with the Ontario government to enact this legislation for quite some time. But everything has happened fairly quickly in the last couple of months. So it came into effect January 1st, 2023, and we're really excited about it.
What kind of pressures does this put on pharmacists at a Shoppers Drug Mart, for instance? Does this require more staff because you're going to be involved in doing a lot more consultation?
These are things that we regularly see patients for in the aisle to begin with. We were just able to recommend over-the-counter options in the past, and now it broadens the treatment options that we can offer our patients. But we do anticipate there will be a higher demand, so we are upstaffing appropriately to make sure that we have the available resources to offer this service to our patients on a consistent basis.
Some pharmacies do have an area where they can take some customers aside and have more of a private conversation. Do you foresee a lot more of that in the future?
Most pharmacies, as you mentioned, do have private consultation rooms. But I think as we move from a dispensing model to more of a services model, we will see increased private consultation rooms in pharmacies. I think that there will be some pharmacy redesigns that we see in the next few years where there are multiple consultation rooms where pharmacists can bring patients aside, as we do want these consultations to happen in private and make sure that patients are comfortable in speaking with some of these issues with their pharmacist.
Now, these are all minor ailments, these 13, acid reflux, impetigo, skin rashes, things like that. Do you foresee that in the future this list will expand to some other minor ailments?
I think it will. This is a great starting point for pharmacists in Ontario and for our patients to be able to access these services. However, in other provinces, pharmacists do have a wider variety of ailments that they can prescribe for. Here in Ontario, for quite some time, pharmacists have had the ability to extend prescriptions, which means that if a patient's already controlled on therapy, pharmacists can assess the patient and extend that prescription, for example, for 3 months until patients are able to follow up with their primary physician to be further assessed. So we do have that authority, but this new legislation is a little different in that pharmacists can initiate a new therapy, so something that a patient has not been previously taking. So I do think that will expand as the healthcare needs evolve in Ontario.
Will there be a charge for that consultation, for that prescription service?
No, if patients have a valid Ontario health card, it is a publicly funded service, which they can access at any pharmacy in Ontario, preferably their usual normal pharmacy. So there will be absolutely no charge to the patient for the assessment, and then any normal prescription fees will apply based on patients' private insurance for their medications.
Roughly a week has gone by since this took effect. Have you seen a big difference in the demand?
Yeah, I wouldn't say a huge difference in the demand. We're still having the same types of patients come into the pharmacy, but a difference in the service that we're able to provide them. So we see a patient, in the aisle, example, for pink eye, and in the past, when we would have only been able to recommend over-the-counter options, now we have a wider variety of options to offer our patients and more effective options.
Jamie, thanks for joining us today with this great news. Great news for our healthcare system as well, because obviously fewer doctor's appointments for those minor ailments. Thanks again.